All right, I think we've got critical mass here. So I am going to get us moving since we have a full session this afternoon. Welcome to our third and final day of the eHi virtual member meeting. It's been a wonderful week so far, and we're excited to close out the conference with two excellent discussions, one on health and data privacy and the second on digital health policy. But first, we're thrilled to kick things off with a discussion our CEO, Jen Kovich-Bordenick, had earlier this week with Nevada Senator Catherine Cortez Masto about federal data privacy legislation and her state's efforts to responsibly use health data to combat COVID-19. Senator Cortez Masto is the former Nevada Attorney General and the first woman from Nevada and the first Latina ever elected to the United States Senate. She sits on 5 committees, classic underachiever: the Committee on Finance, the Committee on Banking, Housing and Urban Affairs, the Committee on Energy and Natural Resources, the Committee on Rules and Administration, and the Committee on Indian Affairs. We're honored that she took the time to speak with us, so please enjoy.
Welcome. Good morning. I'm so excited that we have with us today Senator Cortez Masto, who is from the wonderful state of Nevada, and we hear it's snowing out there today, so that's great news. Thanks for taking time to speak with us this morning about your work with healthcare and privacy and the importance of federal legislation there. Just so you know, we've done a lot of work with the Center for Democracy and Technology on privacy. We've got a large grant from the Robert Wood Johnson Foundation, and we recently have created a framework for consumer health data and how to protect consumer health data right now. So we're primarily focused on data that's not covered by Hipaa. And there's a wealth of data out there right now in healthcare that's just not covered by Hipaa, but collected in all of these mobile apps and used in all sorts of ways. We've seen that all throughout COVID as well, and for good reason. We know that data needs to be collected. But this is something that we're concerned about, and we feel like there should be some sort of legislation to help strengthen privacy protections. I know that you introduced the Digital Accountability and Transparency to Advance Privacy Act, or the DATA Act, if I got that right, which allows consumers to consent. And I think most of the folks in our audience understand that that means, opting in or opting out. And it also gives new authority to states' attorneys generals and the FTC by levying these civil penalties. One of the things that we've really struggled with is, how do you enforce this? So could you talk a little bit about kind of how you envision the enforcement of these rules and what that might look like?
Well, first of all, thank you for having this conversation. I so appreciate all the good work that you all do, and so happy and excited to join you, Jen. Let me say this, as a former Attorney General, right, as well as somebody who's worked closely with the FTC and now in my role as the Senate, the goal really has been, how do we understand now the change around this use of data that is being collected and the information, and what are the protections for the consumer? How do we make sure that there's a role for the consumer to play, a role for businesses to play? And how do we define this data, and how do we ensure there's no discrimination, right? But there's reasonable use of it. So it's a combination. You're trying to find this balance at the end of the day. And that was really my role, and my goal with this Data Privacy Act was really, the focus was, how do we start looking at this data from a different prism or a different view? And what do we need to do to give, in my role now as a senator, maybe the FTC, who has enforcement already under Section 5, unfair and deceptive trade practices, but we have to define it and broaden it a little to include this new age of data, right? So how do we give them guiding principles, really is what I was looking for, guiding principles where they can engage in rulemaking, so everybody knows, from the businesses to the consumer, what the rules are, and that then you follow those kind of the rules that have been set. And if they violate those rules, and that's when the FTC, or that's when the AGs would come in to engage. And that's really what we have here. And so I really started from that premise, and then started looking at, okay, what types of businesses and what type of data, and from a consumer protection point of view and a consumer point of view, how do we give the consumer more control over their data, particularly sensitive data? And you know that very well. How do we give them more control, but not overburden them? So there's got to be this role that the businesses play for more transparency, giving the consumer more information, make it concise, understandable, readable about the data that they're utilizing. It has to be for a legitimate business purpose. It can't be used to discriminate or used deceptively. But it also gives that consumer control to know, okay, here's times when I opt in, and here's times when I give consent. Very easily to say to a consumer, listen, if this business has a legitimate purpose for some of your personal data, your sensitive data, then you give them consent to do so, to use that data. That's very easy. And so we're defining that the realm of the data into sensitive data when a business would have to get the consent from the consumer. Otherwise, the other options would be then businesses then go ahead and engage in a legitimate business as long as they're collecting data that's not sensitive, but give the consumer the understanding of how that data is going to be used. But it also gives the consumer the ability to say to that business, okay, what data are you collecting? Is it accurate? Can I delete it? Can I change it? But working with the businesses, right? Because there is a need for the collection of this data at times for so many reasons. And we want to find that balance between the two. And that's really the goal here, is to give a kind of like through this Data Privacy Act, just general principles. So then the FTC can engage in rulemaking, which we know then brings the businesses in, the consumer advocates in, everybody coming together, defining what this new world looks like when we're collecting data, including that sensitive data, and what the enforcement will be at the end of the day. That's very simply, that's what it does.
So there's thousands of companies out there collecting data and using data, and it's just so hard to track what everybody's doing. So you ultimately see this as kind of the state attorney generals kind of driving this oversight and enforcement at the state level using.
No, I don't. Actually, no, I don't. Yeah. So let me jump back here.
Yeah.
So for purposes of just in general, the enforcement of unfair deceptive trade practices. Yeah. So the FTC has that at the federal level under Section 5. All the AGs that I know in their states have a state version of that.
Right.
And so that's why we work in conjunction with one another. There's state laws, there's federal laws, and usually the state AGs are focusing on unfair and deceptive trade practice that violates state laws. And at the federal level, they're doing the same thing when the FTC is doing the same thing when there's a violation at the federal level.
Right.
What this is doing is taking, because we haven't really opened the door for that, how you define unfair and deceptive trade practices in the realm of data privacy and data collection. All this is doing is saying to the FTC, here's how we want to give you guiding principles to start looking at how do you incorporate this whole new world of collecting data and data privacy so that you can allow businesses to engage and continue to collect this data, but you give some protections to the consumer as well. Right. That's all it does. And so what I have found is as the feds and as these laws are broadened or they are, there's rulemaking that you find this balance between businesses and consumers in this space, you usually will find in the states will follow similar path of legislation that has been already taken up at the federal level. Now, with that said, there may be states already that have taken this jump and defined data for themselves. I know Nevada has done that to some extent when I was AG. But there needs to be this commonality here, because I do get and I really appreciate the fact that businesses, are also concerned if they are doing work at a national level. There's different laws in different states and how they address this. And so the goal here is to try to work through all of this so everybody's understanding with respect to the data that we're defining, how we enforce it. So so the businesses really aren't challenged. And at the end of the day, the consumer also knows that we are defining this based on the data itself and the type of data, not who holds the data.
Right. So this is a really tough area, and we work with a lot of tech companies and a lot of consumer advocacy groups, and it's always hard to kind of find consensus here. So the baseline authority for the FTC is really all that kind of holds these county companies accountable right now to adhere to these privacy policies. So I'm wondering what advances, with this new Congress. There's all of this talk about privacy right now. We all know the history of what happened in the last 2 years. What kind of advances do you think Congress can make now with respect to kind of some type of comprehensive data privacy legislation? We know that that's not, the number one priority right now for this Congress. COVID certainly is. But do you see, any advances being made in this next Congress or baby steps, 5 years from now? How long is this going to take till we get to some federal legislation?
Well, here's what I am hopeful as I'm talking with my colleagues is, yes, we start, particularly starting with the Committee of Jurisdiction in the Senate, which is the Commerce Committee, that we start having this discussion and we start holding hearings. We pull businesses in, we pull consumer advocate groups in, and we start defining this. I've got my legislation out there. I know my colleagues, Senator Schatz is looking at some, Maria Cantwell. I know Senator Wicker. There's a number of senators that are looking at this space. We now have to start having the hearings. We need to pull the experts in. We need to have the FTC there. We need to have the businesses, the consumer, like I said, the consumer advocacy groups. And let's just have this conversation. I know we started a little bit of it over the last 4 years. We never finished it.
Right.
And so we have to engage it. We have to define it, and goes back to defining these guiding principles. It's not obviously an easy area to legislate in. And so we have to start hearing from the experts and figuring out how we get this done. Because let me just say this, on Commerce is one committee of jurisdiction where we have to start looking at this, but I'm on banking, the banking committee. This is an area I'm looking at in the financial sector as well. So it covers so many different areas. And I think it's time we just have this discussion and start figuring this out and defining and giving these guiding principles. I believe that's what we should be doing at a federal level, giving guiding principles around this space of data privacy.
Right. And what we found is it's just really difficult to distinguish now what's health data and what's not health data. It's all really consumer data.
Well, it is.
Yeah.
Can I just say one thing? Because you're absolutely right. And I think this is part of the challenge. I know, as an AG, very familiar with the Hipaa laws.
Right.
And what we have defined is, what we have said is we're going to define privacy around who holds the data versus what type of data it is. So we need to start looking differently at the data. And that's why, for me, it's starting with, okay, what's the sensitive data? What is the data that every consumer would have concerns about, that information getting out, how it's being used, and work with the businesses and how we protect that sensitive data. Maybe that's where we start first.
Right.
And how that sensitive data is being protected, and what are the privacy laws around that?
I think, we really share that perspective in terms of our framework that we're releasing. So, and we are very, very interested in hearings and continuing this discussion. So it's so wonderful to hear you talk about that. Let me just shift a tiny bit, because we are all right now immersed in COVID. And, all the technology companies, all the healthcare companies, of course, we're all focused on COVID right now and how we can use technology to really support addressing the pandemic. And we know that this really includes the need for gathering large amounts of information across the country. And we know that there are very limited resources, particularly in public health, around collecting data and having technology. We just don't have that structure right now in public health. Can you talk a little bit about your state? So what needs does Nevada have related to kind of resources for data and technology to address the pandemic? Is there a need for federal legislation to help support public health, in terms of gathering data and technology? Just, give us some examples about what Nevada looks like and how federal legislation could possibly address it.
Sure, thank you. Well, a couple of things. Let me just put in perspective for purposes of folks to understand the impact the pandemic has had, not just across the country. In Nevada, it's been devastated because our main revenue generator is hospitality-based industry, right? The service sector, from trade shows to conventions to gaming, hospitality in general. And as we all know, when people are sheltering in place, businesses are shutting down, nobody's traveling. That has had a major impact on our state, our revenue. Now, that revenue is important because if we are going to continue to address the pandemic, to make sure that people are getting tested, that they get their vaccines, that we are keeping track of all of the information, we need the money for the technology, right, to be able to collect that data, to understand it, to collate it, and then utilize it to understand what still needs to be done. So because the revenue has been cut and because we are challenged, our technology systems are being challenged. Much of the technology that we use in the state of Nevada is really old technology. It's antiquated, right? I think not every state is like this. Some are, however, really just antiquated technology that we need to upgrade and update. And so we are dealing with the pandemic at the same time trying to kind of what they say, build the plane while we try to fly it, right? So that's the challenge I think we have. Other states I'm hearing have the same challenges. With that said, that is the purpose for the COVID relief packages that we have passed, is getting that money into our states so that they can address the healthcare piece of the pandemic, but also the data collection, the technology that they need to address and understand the implications and impact of the pandemic to overcome some of the disparity that we see. So it's a challenge right now. Now, add to that, not just in Nevada, but we are sharing this data, this healthcare data across the country now with the federal government, right? Because we all are trying to understand who has it, maybe tested positive for it. How do we get the tests out there? How do we get the vaccines? Who's had the first dose? Who's had the second dose? Where's their disparate treatment of healthcare? I know I've seen it in my state amongst communities of color. So there's so much going on, and this data that we do have is being shared across the country. Mm-hmm. How do we protect it? And that is the impetus of another bill that I have. And I have one of my Senate colleagues, Deb Fisher, has joined me on this. And this is really about privacy and supporting privacy enhancing technology. And the bill is promoting digital privacy. It's promoting Digital Privacy Technology Act. And what it really does is supports National Science Foundation on more research and funding to figure out how we really develop this privacy enhancing technology that can then be incorporated into our businesses, into our state functions to protect this data. And so that's a piece of this that I think is so important. I actually pulled that out of my Privacy Act and just really focused on that piece of it to get that moving. Because I think it's so important for our businesses to have access to this technology. If we're saying, listen, we want you to protect this data, but there's no technology to help them do it, really we're putting them in a difficult situation. So part of the other bill that I have is to work at the federal level is let's work and figure out how we develop this technology that helps us protect this data, and we give it then to our businesses and work with our businesses so they can incorporate that, including our state governments where we know collect so much of this data around individual healthcare.
Absolutely. And that sounds like a really important piece of legislation. And then, one final question. We heard President Biden, it's interesting to say, new president's name, President Biden, talk about, the need to really pass this COVID legislation quickly, and that he hoped to get bipartisan support. But we also know, how we're all suffering, and we're at an incredible lack of resources around the country. What are your thoughts in terms of bipartisan support for this, and how long it might take to, how long we have really to push this through?
Well, I know just on the most recent COVID relief package we passed, it was to be a bridge, because I know unemployment is going to run out in March 14th. That's the deadline now under the new relief package. So we have to do something. I can tell you just in my state, just what I was telling you about the hospitality industry, we're not going to come out of this in the next 2 months. It's going to take us time to come out of it. I have the second highest unemployment rate in the country. I have so many people that have been devastated in my state because we've had to shut down our businesses. So it's going to take us time to come out of it. I believe, after talking with some of my colleagues on both sides of the aisle, there is support really for addressing this pandemic and looking to see what else needs to be done. And I'm hopeful that as we move forward with the Biden administration package, that they're going to recognize that more states still need to address this pandemic and come out of it. And we're all going to work together to get that done. I'm hopeful. I know there's bipartisan talk right now. You know, the group of senators that really kind of kick-started the last COVID relief package are meeting now. I'm talking with them. I know that there is an opportunity to work together to move forward, but we have to. It is a must. I know, you know, unfortunately, the last COVID relief package, my Republican colleagues didn't want to support more funding for state and local government, but I can tell you in my state, we need it. I'm hearing it not just from my state, but from my local governments, both in our rural and urban areas. There still is a need, and we have to invest in that need right now because everybody is dealing with this pandemic.
Well, we wish you the best of luck with that. And I want to thank you again so much, Senator, for your time this morning. We truly appreciate it.
Thank you, Jen. Thank you, and good luck with the rest of the conference.
Well, thank you again to Senator Cortez Masto. I think that was a terrific way to tee up the day that we have ahead. I'm going to start our second event, our first panel of the day, Protecting Health-ish Data, Balancing Innovation and Health Data Privacy, and introduce myself first. I am Alice Leiter. I am the Vice President and Senior Counsel at the eHealth Initiative. I'm a health regulatory lawyer by training with a lot of experience in health data privacy. And it is my great honor and delight to be joined by an illustrious panel of experts. With us, we have Jodi Daniel, Laura Hoffman, and by phone, heroically, because some storms out in Sacramento have interfered with internet access, we have Liz Salmi. I'm gonna let each of them introduce themselves and then we will get started. Jodi, do you wanna start? I think you're muted, we can't hear you yet.
Can you hear me now?
Yes.
Oh, perfect. Great. Sorry. Hi, everyone. Thank you so much for inviting me. And thank you, Alice, for hosting this panel. I'm Jodi Daniel. I am a partner at the law firm of Crowell & Moring. I lead our digital health practice there. And prior to coming to Crowell & Moring, I spent most of my career, my legal career at the Department of Health and Human Services, where I was involved in drafting of the original Hipaa privacy rules, served as senior counsel for health IT, and then served as the policy director at the Office of National Coordinator for Health IT for the first 10 years of that office's existence. Pleased to be here. Thanks a lot, Alice.
Oh, thank you. A health IT super rock star celebrity. And Laura, no less illustrious. Go ahead.
Not sure about that, but I'll take it on a Thursday morning. I'm Laura Hoffman. I'm Assistant Director of Federal Affairs with the American Medical Association. Really thrilled to be here with, to be on this panel with Jodi and Liz and Alice. Most of my work focuses on federal health IT policy. Particularly, I focus a lot on HIPAA and other types of privacy laws related to health data, like Part 2, but also now doing a lot of work and thinking about health-ish data that isn't necessarily covered by HIPAA, but is still health information and really important to be thinking about as we're starting to increase the exchange of health information outside of the HIPAA covered space. So looking forward to the conversation today, and I'll hand it off to Liz.
Great. Okay. Thank you so much. I'm sorry I couldn't be on video for you guys. Storms are preventing my full access to the internet, but hopefully my smiley face is a good substitute. I am Liz Salmi. I have two hats I wear, I think from two brains. I exist on two coasts, both in Northern California and Sacramento, but sometimes in Boston. My work, I am the Senior Strategist of Research Dissemination for the OpenNotes project. We're based at the Beth Israel Deaconess Medical Center in Boston, which is one of those Harvard Medical School teaching hospitals. And the OpenNotes research team has been studying for the last 11 years or so the effects of open and transparent communication on patients, care partners, and clinicians, specifically as it relates to the information in our medical records, especially progress notes resulting from clinical visits. But in addition to that, in my workspace, a key perspective I'm bringing to today's discussion is my background as a patient advocate. I was diagnosed with a malignant brain tumor in 2008, right after my 29th birthday. And there's really no right way to respond to a brain cancer diagnosis. It's kind of a big deal, but I responded with curiosity, and I fell in love with my online patient portal and the information I could find there. And that time period from 2008 and beyond was not long after the popularization of online patient portals, which are attached to health systems and electronic health records. And then the HITECH Act and meaningful use kicked in around like 2009-ish. So much has evolved since then, but as a person who identifies as a patient, my whole healthcare experience has really been colored and shaped by this new culture of growing access to personal health information. So I'm going to bring a lot of that to today's discussion, but also color in and part of my comments based off of what I know in our research from the OpenNotes team.
Well, we're really happy in light of that, especially to have you with us today, Liz, and thanks for making the effort to join. I've asked Jodi if she wouldn't mind starting off by giving us sort of an overview of the current legal lay of the land, the legal framework that's governing both health data and non-health data. We talked a little bit about that, or Jen did, with the senator just now, so that sort of teed this up nicely, but there's no one better to speak to what's real, what's not there, what's coming than Jodi. So I will let you begin. Thank you.
Great. Thank you so much, Alice. So I'm going to try to do in like 5 or 10 minutes all of health privacy in a nutshell. So this is not going to go into great detail of requirements, but I really wanted to start by talking first about Hipaa. It is the foundation of health information privacy and security and data use. And interesting. While for all of the issues people might raise about Hipaa, it really was ahead of its time. It was, the Hipaa statute came out in 1996. The privacy rule was first published in 2000 and revised in 2002, taking effect in 2003. And this was before before folks were really talking about privacy, particularly sector-specific data or sensitive data. And often, other countries were looking to our practices to see what we did. So it really did serve as a foundation. And remember, this is going back in time before even widespread internet use. It was before we had smartphones. It was before most doctors and hospitals were using EHRs, and really before all the widespread health information breaches. So this was really, a long time ago in the terms of technology of healthcare. And the thing, though, that I think really has helped Hipaa as a solid foundation and standing the test of time is that it was designed to be flexible and scalable. At the time, we knew that there were some very sophisticated players and some very unsophisticated players. And so the goal was really to come up with rules that set a floor and baselines that everyone could follow. And, I remember back in the day, folks talking about, I think we used the word reasonable in the first Hipaa rule, like over 250 times or something like that. I don't have my numbers right. But the goal was to try to come up with reasonable rules that would set a floor and a foundation for what healthcare organizations could do with data and what individual rights there would be. And there have only really been modest changes since the original rules came about. We had the HITECH Act. We had modifications in 2013 that really, were designed to improve the rules with regard to and kind of bring them up to date a little bit with more adoption of EHR technology. But there haven't been foundational significant changes since the early days. And some could say that's a challenge, and we could talk a little bit about that. And some could say that that's a strong point. But it really did set a common set of rules, a common language, and common expectations that I think have really served to enable some innovation to build on top of that, because different players can all talk from that same baseline understanding of what you can and can't do with data. So it really was groundbreaking when it passed. I remember hearing from clinicians about the individual right of access, which was the first time individuals had any rights with regard to their health data, and having doctors literally scream at me in conference rooms, in conferences, about how dare we come up with rules that require them to disclose their personal notes. So I'm really interested in Liz's comments on that. But it really was groundbreaking. Unfortunately, in practice, we have not seen patients getting that kind of widespread access to their data. It is happening more and more. Again, look forward to Liz's comments on that. But the right has been in place since 2003 and in effect since 2003. You know, while in many ways it has stood the test of time, there are a lot of things regulators didn't contemplate when we were writing this. You know, some of the ability for care coordination and health information exchanges, disclosures for social services and social determinants of health, and then uses of data, like widespread uses of data for like algorithm development, for machine learning, things like that, just weren't really thought through. And so there's lots of opportunity for improvement. There are many limitations to Hipaa as well. So we have, obviously, I think somebody mentioned this in the last panel, but it does not apply to all health data. It applies to health data held by certain entities. These are healthcare providers and health plans. It was because the privacy rules were actually driven by a need to protect data that was flowing between providers and plans for claims payment and other financial and administrative transactions. And that's what Congress was trying to address. It wasn't designed to be a comprehensive healthcare privacy rule for all health or health-ish data wherever it resides. So it's not all healthcare providers even. If you have a telehealth provider that accepts only self-pay, they might not be covered by the rules. Some behavioral health providers only do self-pay, and we're seeing more and more of this happen with concierge practices. So there are healthcare providers that might not even be covered. They're like de-identification standards haven't really kept up with modern technology and how data can be re-identified. You know, and then, you know, just the fact that data, the same exact data held by a healthcare provider or plan may be protected, but held by somebody else or held even by the individual might not be. So lots of issues there. This raises the non-covered entity problem. So we have the covered entities held, you know, where Hipaa applies, and then non-covered entities. So as we're pushing more and more data to the patient, pushing more and more data to third-party apps that patients can use to help manage their own care, manage their own data, we have this non-covered entity problem where we have this divide between protections apply in one realm but not in another. And I think we'll talk a little bit more about that. But I think some of the challenges are individuals don't understand that. It is not clear to the common person that that data that they get from their doctor is no longer protected when they have it in, you know, on their smartphone. It sets up an unfair playing field for different providers, different entities in the healthcare space. You know, while there are, and we'll talk a little bit about this, while there are like the FTC may have some enforcement, there is no sort of floor of protections like you have under Hipaa. So now fast forward, we have all these protections that everybody thinks about, like protecting data. And now we have the government having spent $34 billion or more on incentives for adoption of digital health technology and EHRs, saying, wait a second, we spent all this money. We wanted to see the data follow the patient through their care journey. We wanted to improve care and care coordination, and there isn't interoperability. What's going on? The government spent a ton of time trying to develop standards and making sure that technology was interoperable and the data wasn't flowing. And what we found was that the problem wasn't the standards and technology, but really was a people and business problem. There were practices in place that were interfering with patients' access to data, with providers getting access to data, and others. We called this information blocking. There were practices that were blocking the availability of information where Hipaa allows that data to flow. And in fact, you know, the expectation is that data will flow, but it was not flowing to support treatment, to support patients, to support clinical decision support tools, whatever. So HHS came up with 2 new rules this year. Neither have been or are effective yet. They will be effective this year. So there's the ONC rule and the CMS rule. The ONC rule was adopted under the 21st Century Cures Act. And was designed to, there are some changes to the certification program, including promoting more access to data via APIs. And then there are provisions prohibiting the practices of information blocking. So the way this works is that it really flips HIPAA on its head. Now, anything that's permitted under HIPAA may be required under information blocking. So if you're allowed to disclose information for treatment and you don't have a reasonable and necessary excuse, you're now in violation of information blocking. So it kind of flips this on its head. We think about practices and protections, and now some of the rules that were designed intentionally to be open-ended and broad and give people the ability to be reasonable in sharing data now lead to mandatory disclosures. And folks are having a really hard time figuring out how to comply with both HIPAA and information blocking, because like you're now on this tightrope of blocking. And as somebody mentioned in the last conversation, the technology isn't necessarily capable of making the distinctions that are needed to carefully tailor the access and disclosures as permitted under HIPAA. The CMS rule also promotes access and interoperability. This is for health plans having to disclose claims and encounter data and having to disclose clinical data that they maintain through a patient access API. Again, on both of these rules, the government is really promoting patient access to their data in machine readable format through APIs, through the third-party app of their choice, unequivocally. The only way that a data holder that's subject to these rules cannot provide it to a third-party app, it can't be based on the app's privacy practices or how they might use data. They can only withhold that data for very limited purposes, like if it's going to threaten the security of like the health plan systems itself. They can educate patients, and in the CMS rule, they are required to educate patients about privacy and security of apps, but they can't deny a patient access through the app of their choice just because they don't like that app. And it's causing a lot of consternation because of that HIPAA, non-HIPAA divide that I talked about earlier. Just a couple more points, and then I know we have a lot to talk about, but I just wanted to give a good foundation. A lot of folks will say, well, don't worry about the information held by third-party apps because we have the Federal Trade Commission Act, and that covers all these third-party apps. And that's kind of a yes and no. So the way the Federal Trade Commission Act works is it prevents unfair and deceptive trade practices. It does not set a floor for what you can or can't do with data. It just says that if you promise not to do something with data, I promise not to sell your data, and then I go ahead and sell your data, I've just engaged in an unfair and deceptive trade practice, and the Federal Trade Commission can enforce against me. But if I say, I'm going to sell your data, and I bury it somewhere in a privacy policy and you never saw it, but I said it, and then I go and sell your data, I haven't violated any law. I am allowed to do that. There's no limitations on what you can or can't do with data. FTC just says, if you say you're going to do something and you don't, or if you say you're not going to do something and you do, we'll enforce it. The other limitation to the FTC Act is that it only is trade practices. So if there's a not-for-profit that offers a third-party app, that is not covered by the Federal Trade Commission Act. And so even if they violate their own privacy policies, the Federal Trade Commission doesn't necessarily have jurisdiction over that case. So there are limitations there. We can talk a little bit more about that. As far as what's ahead with this, I just wanted to highlight there is a HIPAA proposed rule that was published on January 21st. I think it got through the Federal Register process before it could have gotten pulled back by the executive order on January 20th. So it snuck in there. It is, in fact, an open comment period, 60-day comment period. There's a lot in there to update the rules with regard to care coordination. And if I have a magic ball, crystal ball, I would say that the agency would be smart to leave it and let it ride and let folks comment so they can get input and consider how they might want to handle that. I don't think it's something that's going to move quickly, but I do think it's something that folks should pay attention to, and I do think it will get some attention by the new administration. As far as interoperability, I think this administration is going to be very focused on interoperability, very focused on patient access to data, and they will do enforcement of these rules. That is my prediction. I think that they're very aligned with the general approach, and we'll move forward on that, hopefully with some more guidance. And as far as legislation, I think that any federal legislation is going to be slow. I just don't think it's going to move quickly. I think there might be some activity at the state level. And I think that's really where to watch. I think the feds will sort of up their game if there's a lot of activity at the state level and people are concerned about a patchwork of state laws. I think any federal legislation or even a lot of the state legislation will likely have carve-outs for Hipaa, which is what we're seeing. And that's going to lead to this confusion as well with whether it's covered by Hipaa, is it covered by state law, is it covered by federal law? What about data that's health data but not covered by Hipaa? What about health-ish data? It's going to raise lots of questions. So I think that's something to watch. And I think with that, I will turn it back over to you, Alice, to kind of engage in conversation. Hopefully that was a good enough foundation to kick us off.
Yeah, unfortunately, your billable rate, hourly rate is too high for me to call you as many times a week as I would like to. That was terrific. Thank you. And there are 1,000 things you said that could take this conversation in any direction. But given that we just established the legal framework and the legal sort of baseline foundation of what we're dealing with both health data in the health system and health data outside the health system with these apps and wearables and tech platforms, I wanted to turn to the topic of a different kind of foundation, and that's trust foundation. Innovation is exciting. It is to be encouraged. It is necessary, and the advancements in how we can both provide care and manage our own care have been enormous. But regardless of the potential of a public health tool or a healthcare tool or a care management tool for individuals, they won't be successful if there isn't public buy-in and public uptake. As you mentioned, Jodi, when health data leaves the health system, even if it was protected by Hipaa when it was there, it loses all of its Hipaa protection and enters into this sort of wild west of some state, some FTC, some terms of service, or some overlap, sometimes even conflicting. So I wanted to ask each of you about what you think the consequences are of a shaky or non-existent consumer or patient trust foundation when it comes to the proliferation of some of these new technologies. Maybe Laura, I'll start with you.
Yeah, sure. No, that's a great question, and I think really underpins why we have these kinds of conversations beyond, of course, the need to figure out policy strategy and everything. It's important to kind of figure out why we're doing this and what the patient or consumer need is in any given discussion. And I think, honestly, the past year has been quite instructive for those of us kind of paying attention to this space. An example that I kind of come back to time and time again is what happened with the digital contact tracing apps, particularly last spring and over the summer. There was a great idea, a great need to try to supplement traditional contact tracing for public health purposes with the outbreak of COVID with digital apps and smartphone apps that could use different types of functionalities on your phone, whether it's Bluetooth, GPS, whatever, to alert folks of when they were exposed to COVID. Unfortunately, we saw with a lot of the early rollouts of those apps that people didn't trust what would happen with the information that they provided. Last summer, especially, we had a lot of heightened tension with respect to law enforcement and who was receiving what kind of data. There was a lot of protest activity going on. Immigration proceedings and removals were at an all-time high. Actually, I don't know if that's an all-time high. I don't know if that's correct, but it was going on. And so folks were nervous about providing that kind of information to government authorities, to technology companies. And this is, I think, just really critically important to take away from that experience, which is we can come up with all kinds of innovative technologies, things that will make life easier for patients, things that will help to improve public health and the health of our nation. But if that trust factor isn't there and there isn't understanding from from the very beginning about how one's data will be used, that a person can feel comfortable with, given current social contexts and conditions and everything, then those innovative technologies are not going to be used. There will not be uptake. There will not be improvements in health. So, over time and over the months, these contact tracing apps were refined. More attention was paid to privacy and security of data, transparency in telling consumers who the information was going to and what it would be used for and by whom. And then you started to see a little bit more trust build, a little bit more adoption and download of these tools. So I just think, the last speaker raised a lot about what are some core principles that we need to promote innovation. And I think that's exactly right. And trust is really at the heart of that. The AMA has put out a set of principles that really seek to support that foundation of trust, not only in our technology and our institutions, but also continuing between the patient and their clinicians. So we got to be thinking about it on multiple levels. And I think, Jodi made a great point that Hipaa was really ahead of its time in trying to allow for flexibility and build in a framework and a common foundation for people to work from. And that's really critically important as now all of these additional policies are going to be implemented in the coming years and months. We need to always be thinking about laying that foundation from the start and building in these kinds of protections from the beginning so that it's almost like with COVID itself, we had that Swiss cheese kind of defense layer with masks and distancing. We're building up layers of protection that are easy for consumers to use and feel intuitive. So it's a great question, and I think is really critical to a lot of this discussion.
Thanks. And Laura will share those AMA principles, I'm sure, upon request. Liz, I want to ask you sort of the same question. I think this concept of transparency and communications, I don't want to say so much marketing, but one can imagine that if there had been a different climate and a different set of people or words or messages used to communicate, for example, the COVID tracking apps and why they were important and what they were and weren't going to do, we might have been in a different situation. And I wonder if you could speak, from your work, but also from your experience as a patient, how does this notion of effective education and communication and transparency come into play when establishing trust?
Sure. When it comes to sharing information or connecting your information, I worry, how can we expect people, patients, consumers, what are you going to call us? I'm just going to call us people. How can we expect people to make informed decisions about sharing our information or connecting our personal health information with platforms outside of our patient portals or beyond the electronic health record that's tethered to my health system? Jodi said something awesome that I often think is the average person does not understand the difference between a covered entity and non-covered entity. My husband doesn't know, my mom doesn't know, my neighbor across the street doesn't know. And, us here on the call, we're nerding out about it, but I don't think the average person thinks about that. Once I connect my patient portal login info to Apple Health Records or Citizen or another one of these personal health record merging platforms, I don't really know what happens there. And historically, health systems get to decide what people can see and not see in the patient portal. For years, for like 8 years, all I could see about myself when I logged into my own hospital's patient portal was lab results. But I couldn't see the pathology reports and the surgical reports and my clinical notes with my doctor. And, the OpenNotes research team that I work with, we've done numerous studies. You could read about them. I'm happy to share links. But when patients can actually see those visit notes from the ambulatory visits with their doctors, patients benefit. They better understand their conditions. They trust their doctors more. They can remember what was said. They're more likely to take their medications as prescribed. However, it's just a small percent of the U.S. population actually has access to this information. And, so if most people don't really know what's in their records, how could they actually make informed decisions about sharing that stuff? And I wonder, whose job is it to notify people about what is included in information as they begin to start sharing this? I think about those who If a person receives a diagnosis that requires a lot of individual responsibility, say it's like diabetes, or now you have an implanted device, there's education that comes along with it, so you can be responsible for yourself. And a first step towards trust is creating some sort of digital health literacy that's now part of our new reality. You know, I know it's important to wash my hands and brush my teeth, and flossing is good, but I don't know what it means long-term impact when I begin to start connecting my personal health information with non-covered entities.
Well, that will be the subject of our next eHI conference, is how to do that better. Jodi, if there's anything you wanted to add to that, I want to give you an opportunity.
Yeah, just briefly, I think one of the challenges we have in this, and I think Liz sort of highlighted this, in the foundation we have where some data is protected in certain places and not in others, is that folks will lean on patient consent as the privacy protection. And I think there's a couple of issues with that. I think it's great to give patients the authority to make their own decisions. I also think it's unfair to put the burden on patients at sometimes the most vulnerable times in their lives, right? To understand complicated laws that I just spent 15 minutes just briefly going over with a very educated audience, right? Understand the laws, how they need to protect themselves, what are on these privacy policies, what they should think about, what they should care about, and say, we all do this. I do this. I'm a privacy lawyer. I still click I agree to things without reading through them, right? Because you need the service, and so you'll agree to them. So the consent model, I think, is a layer, to Laura's point. That's an important layer, but it has to be a layer and not the sole privacy protection. It is not, in my view, like it's putting too much of the onus on the consumer, on the patient, individual, to understand those their rights and understand how data can be used. The only thing I'll say is that, just put a little plug in, HHS or ONC at one point did put forward a model privacy notice. I was involved in this and very proud of this work, so I want to just plug it, to help communicate to consumers about how data would be used, and in a way that's understandable to consumers and comparable across different websites. There's not much traction for it because there's no requirement to use it, but having tools in place that make it easier if we're going to put the onus on consumers to understand what they're agreeing to, I think is really important.
I am the beneficiary of that model privacy notice, so thank you for that. But this notion of patients or consumers, people, as Liz said, sort of clicking yes to whatever it is because they want that service or need that service. There's an analogy to this inherent tension that I've always, back on the nerd front, found very interesting about the field of health privacy, which is that very often patients don't actually care what's in their record or who's going to see it or who's having access to their data, because they want the platform, the tool, the service, or much more importantly, the potentially life-saving care so badly. And so much of healthcare and health tech can't deliver on its promise unless there is immediate and widespread access to this data. So we want to encourage that, especially for the sickest patients or in emergency situations. But yet we also don't want to put the burden on patients to have to understand their legal privacy rights. There's a lot of pushback in the provider community to not having the burden be placed on the providers to have to educate their patients about these legal and potentially legal rights, and also have to help them understand which app has better terms of service, and providers are already overburdened. So I wonder just what you all sort of think about this balance that needs to be struck between more access, faster, better now, and the fact that we don't quite have the right privacy protections in place, and how we sort of walk that fine line.
I'm jumping in.
Good.
So I just talked about privacy and concerns, but then I'm going to, argue against myself and say, when, so I'm a person living with brain cancer, and I happen to know many other patient advocates living with various conditions, diseases, but I'm really involved in the brain tumor community. I'm on the board of directors for National Brain Tumor Society, and I know that when somebody is sick, when you get that diagnosis and something scary is going on, and you're looking for the right specialist treatment, whether that's the the hospital across the street because your community hospital doesn't have, the neurosurgeons and neuro-oncologists, or you want to share your health information so you can get that opinion from that right specialist. So hospital across the street, or it could be the hospital across the country. The steps involved with getting all of the information about yourself to then share to get the other opinion takes so much time and effort. And we have the legal right to request and receive copies of a record, but it takes time, effort, and sometimes there's costs involved. So with this new interoperability, or I call it information sharing rule, it will make it so much easier for people who are in serious crises to get the information they need quickly and send it along. And I've heard so many horrible stories of people having to wait 2 weeks, 30 days for a surgery that needs to happen in 3 days. And that is not okay. And I think when people are really sick and scared, privacy goes out the window. You're like, I don't care. I'll post my stuff on the internet if that means I'm going to get to talk to the person I need to talk to. That said, there are no levers, I think about these cookie policies that pop up on the bottom of every website I visit these days, how it's like, hey, we're going to be sharing your information. You select the slider of what information we track and share, whether that's data about, visits to our site, or we're going to share this so we can promote targeted advertising to you. There are no levers for, I want to share my brain cancer information, but I don't want to share my fertility information, or I don't want to share this aspect of my personal experience. And these levers are not baked in at all because the digital tools from the EHR to the patient portal were never designed with patients in mind, because patients aren't the customers historically of any of these platforms. So there's going to be a need to involve patient advocates, patient advocacy communities to design these platforms that were never thought about in the first place.
So I want to weigh in too, if I can here. I think Liz is correct. First of all, those tools were not designed for patients, and I would argue that they weren't even really designed for clinicians, to be honest. But since that's the topic of our conversation today, I won't go on that soapbox. However, I will be really straight with the audience here. Like, I am really tired of hearing this argument that we have to have access or privacy, and that it is just this big, conflict, and it's just impossible. We need to get all the data out there and then worry about privacy later. No, that is backwards thinking. That is the opposite of what we are talking about in terms of laying foundations, incorporating privacy by design, and thinking about the consumer's best interests. While it is likely true for most patients and most people that when they're sick, they want their information shared immediately and with anyone who wants to look at it, remember, that is the patient's choice at that point, right? They are making that choice to share it as widely as possible. And we need to also be thinking about people who don't want to make that choice, or who could be harmed if that choice is made for them, and when information is shared in ways that they are not comfortable with. Because again, just real talk, like, we are not all evenly situated. And so because there is a lack of foundation around what companies can and cannot do with information right now, the floodgates are open. And, Laura Hoffman, as like a relatively young white female in the US, is gonna, I'm gonna be treated probably much differently than a young Black female who lives in a different area and doesn't have the same level of income that I am. When and when you put those two people side by side and they're looking for health insurance later on, or life insurance for themselves or for their children, or, trying to get a job or find a new place to live, that all that information that is out there, amassed by data aggregators and, compiled by people creating risk scores for all kinds of things. Those are the harms we need to be thinking about as we work on privacy policy, because we need to be working against those harms, protecting against those inequities, while still creating pathways for people to be able to choose to share that information. Jodi said, since 2003, we've had this right of access that we're supposed to all be able to exercise. I mean, I've filed an OCR complaint. I've had issues getting my own information. So I get it. We need to make that work. But that does not mean that we sacrifice or put off as an afterthought ways to let people say no if they do not want to exercise that choice. So just wanted to throw that in.
Yeah, can I just say what I was going to say, or ways for people to say, yes, I want you to share that information, and know that there's going to be some basic protections against some of those harms so that they can feel comfortable sharing the information that they need to be shared for their treatment without being worried about, you know, your scenario of somebody who will come back to haunt them down the road because they made a choice. They didn't have a choice of both getting the best care and also protecting against those harms.
Exactly. And that just makes me think of another point, which is, I think Liz is absolutely correct. We need better ways to share pieces of information. We shouldn't, as in the same way that access versus privacy shouldn't be competing against each other, we shouldn't continue to always be faced with this all versus nothing kind of sharing paradigm. We need to think about better ways that technology can help patients and clinicians do that.
Well, that is a perfect segue into my shameless plug for the work we have been doing at eHI over the past year, along with our partners at the Center for Democracy and Technology. With a generous grant from the Robert Wood Johnson Foundation, we spent most of 2020 working on a consumer privacy framework for health data that is geared toward, with the understanding that Hipaa is a little outdated and doesn't protect a lot of the health data that's out there, and that federal comprehensive data privacy legislation is some way out, and that we do need to go beyond mere terms of service or codes of conduct or best practices. We proposed a set of data standards that companies would attest to follow and join a self-regulatory body to hold them accountable to those data standards. And I was going to talk about that anyway, because I think it's a wonderful and apropos proposal that we've put forward, and that will be available or is available on our eHi Resource Center if ever anybody wants to read it. But to Laura's point about the equity issue, we're really hopeful that we're going to have a phase 2 of work on this project. Right now, it's just a proposal. We would really love to make it a reality. But sort of more specifically to the point, we're also really hoping to dig in on these issues of equity, because the commercial misuse of health-ish data or health data not protected by Hipaa has disparate and often inequitable consequences for people. It's very often, as Laura said, that it's a matter of education, but it's also often a matter of race or socioeconomic status, that the way that the harms occur and shake out with respect to violations of basic terms of service, or even just flat out, criminal behavior really has a disproportionate effect. So we're really hopeful that this next phase of work on our consumer privacy framework will address that. Laura was a member of our illustrious steering committee on that work, and I couldn't be more grateful. Again, not to make it about eHi's work, but I wonder what you all see as the value of putting the onus for protection on the companies. I see great value in it, of course, because we've discussed how it can be tough on the patient or even impossible for the patient. Clearly, providers have a lot on their plates anyway. Do you see this as being something that tech companies would be willing to step up and hold themselves out as a privacy all-star? We heard a lot that there's a market benefit to it, that there's a commercial advantage to being able to say, look at us, we're doing it great. You're reading all these horror stories out in the news of companies doing horrible things. We are going to take this extra step to attest to standards that go beyond Hipaa or even FTC. Is that Pollyanna of me? Do you think that that has value as a proposal or a reality? And I ask that of all of you.
I mean, I will selfishly say, again, as part of the steering committee, I hope so. The cynic in me says that a lot of companies like to talk about how they want to do this and how they value doing it, but when it comes time to actually do it, they may not. That said, I think consumers are paying a lot more attention to privacy than they have historically, and making some decisions based on privacy protective features. So, we're trying, folks that we talk to, whether they're vendors or other stakeholders, we think there's real competitive advantage to saying that, you're starting to think about some of these issues now before you're required to via regulation or, some kind of new federal privacy law. So I think, we see some of this kind of play out in the market space, like, Apple has now started using their privacy labels for their apps in the App Store, and I'm certainly making decisions based on that. Yes, I am a nerd and do that. I recognize most people might not, but maybe more and more this kind of behavior will increase. To the point about clinicians and their burden, we've seen. Pew, for example, recently did a poll that showed that consumers did not really understand that Hipaa doesn't apply to most apps. Even though they wanted to use those apps, they didn't quite get that disconnect, which, Jodi mentioned in the beginning. And most respondents in that survey said that they would look to their clinicians to help provide guidance to them about the kinds of apps that they should select to manage their health information. And while we certainly love that patients will look to physicians for that guidance, at the same time, it's really hard for, any given clinician to know the ins and outs of an app that their patient might bring to them. So having some sort of trusted system and framework that not only sets guidelines, like you said, there are a number of great resources out there, whether it's the ONC Model Privacy Notice, the Caring Code of Conduct, or AMA stuff, that's one thing, but then having the bookend to it of some kind of enforcement mechanism, I think adds another layer to these other frameworks that exist right now. It provides that bookend of enforcement, accountability, and hopefully a little bit of peer pressure. So I guess time will tell whether folks try to adopt some of these practices before they are legally required to. But I think that clinicians would find it very, very helpful to have some sort of body they can look to that says, look, we do this, this, and this, and we check you on it, and we make sure that you're actually doing what you say you're going to do. And, just one last thing, I guess I'll say, and then want to hear from Liz and Jodi, of course, but, Jodi was talking about the FTC Act and some of the limitations of that. And, the other thing I would raise is that my understanding is that the FTC often can only have a settlement action initially and can't impose certain types of penalties until that settlement agreement has been broken by the company. So they kind of need a few bites at the apple. So I think it's also important that we start encouraging, the FTC to act with all of the tools that they have available to them, like the health breach notification tool. That kind of increased enforcement on the federal level, combined with some sort of, private sector standard that, sets a baseline and then helps companies to enforce it before the FTC has a chance to get to them. I think that's an added benefit. It's a way to help basically support the FTC's work as they hopefully expand some of their enforcement activities.
I'll jump in here and make a brief comment, Alice. I don't know what the right word is. I am hopeful but skeptical. I think it's really important to set industry standards in the absence of anything else. I think it's a great step, and I very much applaud the work, and I know it's hard work for a couple reasons. One, because it can also serve as a basis if there is any legislation or rulemaking or things like that. It may actually be a strong basis for helping the policymakers think through the issues. Yeah, but as far as I do think most tech companies, at least particularly the bigger ones that are really trying to make a play in healthcare, get the importance of privacy and trust and really want to do the right thing. I just think it's going to be hard for them to agree to bind themselves going forward without knowing what they're binding themselves to, without being required to, and maybe, and also it's going to be really important what those principles are and how much they think it's going to impact their their commercial, benefit down the road, right? So what the rules are is going to impact whether they're adopted. We saw, like with the model privacy notice, Apple actually used it. Others did not because they didn't have to, and they didn't. While maybe there's an advantage to being privacy protective, it wasn't enough that it was worth, putting out your dirty laundry and kind of showing the world what you're really doing. That said, I think it's important work. And I think we need to think about what the next step is, which I think Laura was saying, which is, why would they do this, right? It can't just be because you want to be a good player. It's got to be because doctors are going to refer patients to people who are on that list, or to companies that are on that list, or because there is some benefit that they see in terms of dollars that to being privacy focused, that translates into greater use of their product over somebody else's. So like if doctors started pointing to, here are the apps that are on this, that have met this code of conduct, that's a good place to start, and it helps the doctors not have to educate their patients, and it gives them something to turn to that has some has some rigor to it, then people might want to be on that list. So I think it all depends. I think the uptick will very much depend on what the consequences are of doing it versus not doing it. And I think there have to be some either positive incentives or disincentives to not following a code of conduct. Just my 2 cents.
So Jodi and Laura said half of the stuff I would say. And so rather than repeat them, I'd say, what do I think of this? The fact that you're working and funded from Robert Wood Johnson Foundation makes me think, okay, they're in league with some legit people who I naturally trust. That said, this concept, you're not the only organization that is coming up with some sort of privacy framework or pledge. And so I've seen a couple of these being developed over the last year, and I have participated on some panels and similar discussions where I've asked, who's going to hold everybody accountable when they've made these pledges? Who enforces this? And who are you partnering with? And as a person, a consumer, I'm like, well, how many pledges do I need to be familiar with, or who has the better pledge that I need to, recognize the seal of approval? I think about Energy Star, or the Good Housekeeping seal of approval. There's been so much like marketing and communication around that I recognize, if this washing machine has an Energy Star badge on it, they must have, ticked through some various requirements in order to earn that from I think it's the Department of Energy who has that thing, in which case now, government is involved. So I'd love to see it become one thing that I don't need to keep re-educating myself about everybody's different plans. And that said, you say you achieve the Energy Star or the health privacy version of that seal of approval. These for-profit platforms, their privacy policies can change at any time. And so who reviews, the annual, is Apple or whomever still abiding by that policy? Did they change it? Because the privacy policies are so long and I'm not going to read every single word. So I'd love to see enforcement and a review of that. And people, in the last 10 years, things have been tough. People are burnt. Gaining trust is really hard. There is buying and selling of health data as it is now in ways that most people don't see. I think there are companies that buy information, de-identified health information from health systems only to sell it to pharma or whatever. And so there are entities that make money off of our health data. And as people start to see what's in their record and the curtain is lifted and understand the value they can get for themselves in the health data and they want to see it, they also recognize, well, it's kind of scary for that out to be on the market and they might lose a little trust. So this is an interesting time, and I'm really glad that you guys are focusing on it.
Well, I will not give my entire presentation about the consumer privacy framework, but I will say it does involve a self-regulatory body that would be responsible for the accountability and enforcement side that you talk about. That the idea is that it is different from the codes of conduct because it has carrots in terms of reputational benefits, but also sticks in terms of audits and spot checks, and would be run by an independent organization. And again, I'll just tee it up. You should go and read it. It is excellent bedtime reading. It'll put you right to sleep. And with that, perfectly, we are at 1:15, which means we're out of time. I could talk to the three of you for 3 hours, and I'm selfishly sad that this is over because I've so enjoyed working with you. Thank you, Jodi. Thank you, Laura. Thank you, Liz. This has been a wonderful discussion. I recognize we didn't get to the questions in the Q&A box, but I will make sure that we keep track of those and get an answer to you all after the panel concludes. So thanks again.